forward because we're going to move to the all get along issue of healthcare for a couple of minutes. And Beth, you have a question for Mr. Ginta.
Yes, I'm delighted to be asking this question. Healthcare.
Are you having fun?
The Affordable Care Act was clearly the most high-profile issue Congress undertook this year, and you each have very different views on the impact of the healthcare bill. What do you think the bottom line will be for business owners who will soon be required to provide coverage for all employees? Will this lower their premiums?
Well, I don't support Obamacare. First of all, I think it's unconstitutional, and the country cannot force people to purchase a good or service. Secondly, it does not address its basic expectation, which is to lower cost for business, small business, and the consumer. It has done the exact opposite. We've spent $1 trillion. I've talked to businesses in the last several weeks who are starting to receive from their carriers a 3% surcharge simply because the bill was voted in. And finally, there are people who are now losing their coverage, unfortunately, as a matter of this forced piece of legislation. That is not the intention, I think, that anyone had. What we do want to do is reduce cost and expand the opportunity for a free market system here in New Hampshire. And there are three specific things that we can do that I don't think are partisan. They're just logical. First of all, allow a small business owner to pool with other small business owners so they can negotiate with a carrier like I could as mayor. Secondly, allow businesses to purchase health insurance anywhere in the country, which brings immediate free market solutions to New Hampshire, and allow physicians to stop practicing defensively by having meaningful tort reform. Those three things alone could have a positive impact on our health care challenges in our country.
Thank you, Mr. Ginta. Congressman, take 1:15.
Okay. Well, first of all, he's talking about expanding the free market system here in New Hampshire. There were two insurance companies that had the market pretty much wrapped up, so it's simply not true. I'm calling it Obamacare. I know you got those talking points right from Washington. You travel down there frequently for fundraisers. However, all those things that you suggest were done. We did put in pooling so that they can come together and pool to get a better rate. And that's the point of the exchanges, as you know. Also, they can form compacts. New Hampshire can form compacts with other states that drive down costs. But you don't want them to travel all around because we have different consumer protection rules here than, say, Mississippi. And so consumers would see a race to the bottom. The premiums would go up and what would be offered would go down. The other part of it is we should do more in tort reform. And there are pilot programs there to study that. And there's other policies that they've passed. But we do need to do a little bit more in tort reform. As I said, this is not a perfect bill, but we pushed the train out of the station. There's a lot to be done. But Frank isn't saying what he'd give up. What would he give up? The right to have insurance in this country, the right not to be kicked off your policy, the right to stay on your policy if you get sick, the right to have your child covered, the right for seniors to close the donut hole, the right for free preventive exams for new policies and for seniors on Medicare. It doesn't say what he'd give up.